Hello guys, today our topic is dysphagia. Dysphagia refers to difficulty swallowing, and there are two types of dysphagia. One is oropharyngeal dysphagia and other one is esophageal dysphagia. So now oropharyngeal dysphagia. As the name suggests, there are two words. Oropharyngeal means problem is in your oral cavity or the pharynx. That's why your swallowing is difficult. And in oropharyngeal dysphagia, you have difficulty in initiating swallowing movement, and it is associated with choking or aspiration of food in lungs or nasal regurgitation. Means when your food does not go to your esophagus, your food pipe, so the food will regurgitate, come back through your nose. And this type of dysphagia is more for the liquid food than the solid. Means you will have more problem with liquid foods than the solids. And how we can diagnose this? We diagnosis is through the video fluoroscopy. Now causes of oropharyngeal dysphagia. There are two type of causes: neurological causes. Neurological causes include bulbar palsy. Bulbar palsy is basically lower motor neuron lesion of crenulum 9, 10 and 12. These supply the pharyngeal muscles and tongue. So the pharyngeal muscles and tongue help in swallowing. So when these nerves get paralyzed, swallowing gets difficult. And number second is pseudobulbar palsy. Pseudobulbar palsy is the upper motor neuron lesion of crenulum 9, 10 and 12. And stroke. In stroke also the muscle get paralyzed. So swallowing gets difficult. And number fourth is myasthenia gravis. Myasthenia is basically the problem in its neuromuscular junction. Second cause is structural. In structural causes there is oral cancer and Zenker's diverticulum. So here is picture of Zenker's diverticulum. It is one of the structural cause of oropharyngeal dysphagia, and Zenker's diverticulum is outpouching of the mucosa through the cricopharyngeus muscle, and food which we eat accumulate in this pouch, and there is difficulty in swallowing. Now the second type of dysphagia, which is esophageal dysphagia, it refers to a sticking sensation of food after swallowing. Means pathology is in your esophagus, your food pipe. Esophageal dysphagia is caused by either obstructive lesion or motility disorders. Now the causes of esophageal dysphagia. One is the obstructive lesions. It causes dysphagia more for solid food than the liquids. Obstructive lesions are diagnosed by endoscopy and biopsy. And example are the stricture. Strictures are due to the ingestion of acid or alkali, or GERD, gastroesophageal reflux disease also cause the stricture, and esophageal webs. And third one is the esophageal carcinoma. It also causes the obstruction, so the swallowing gets difficult. And here is esophageal stricture, which causes esophageal narrowing, and so the swallowing gets difficult. And stricture is caused by acid ingestion, alkali ingestion, and gastroesophageal reflux disease. And here is the picture of esophageal web, which is normally the extension of the normal esophageal tissue, and it consists of mucosa and submucosa, and esophageal web can occur anywhere along the length of esophagus.
Now the second cause of esophageal dysphagia is motility disorder. Motility disorders cause dysphagia for both solid foods and liquids equally, And normally what happens, peristalsis occur in the esophagus, which is the movement of the esophagus which propel the food from esophagus towards the stomach. When there is a pathology in the movement of the esophagus or there is a motility disorder, this food does not propel and food gets stuck into the esophagus and dysphagia occurs. Motility disorders are diagnosed by manometry and barium swallow. Manometry, which measure the pressures in the esophagus, and it also measure the pressure in the sphincter, lower esophageal sphincter pressure. And motility disorder example are the eclasia and the diffuse esophageal spasm.